The public testifying on two bills in Augusta today regarding the creation of a universal health care system in Maine. Supporters say the current system is at risk of collapse, with hospitals continuing to close and possible Medicaid cuts on the way. One bill would ask the Office of Affordable Health Care to study what this plan would cost. The other calls for the full development and implementation of health care for all. Supporters believe it will save money in the long run and cover everyone with better benefits. Republicans claim too many people are already on Maine care, and the cost of this plan would only make things worse.
I think it would be very difficult to do this financially. I think what we have seen in single-payer systems is a situation where the cost would rise precipitously, and I think the other problem is care would be rationed. There'd be people that would not be able to get care.
Well, if everyone is all on one plan, it will generate administrative savings and efficiencies that would leave enough money in the system to cover everyone with better benefits.
The bill is now moved to a work session within the committee to be voted on at a later